The doctor is in.
Hi guys, thanks for joining back in. This is your pal again, Dr. Sal, and in today's episode, let's take a look at the medical topic of Bupropion. So Bupropion comes in several different strengths, just like most other medicines, because one size does not fit all. You would not be happy going into a shoe store and just finding that it had one size. So similar for medications, there's always a spectrum because there's always going to be differences in consumer needs. So Bupropion comes as 100 milligrams and 150 milligrams. So this is Bupropion. And typically with Bupropion, it's called SR, which stands for slow release. There's also another variation, which also comes in 150 and 300 milligrams, which is called Wellbutrin. Now, for the life of me, I tried to see if there's any differences between these two. Oh, sorry, Wellbutrin XL, which stands for extra long release. And it appears to me that there's no substantial difference. The half-lives are the same. The side effects are the same. So it appears to me to simply be a marketing gimmick. They're basically all the same thing by different names. The marketing gimmick goes even deeper than that, however, because you may recognize in that name Bupropion, this guy here, the 150, has also been further marketed as Zyban, which is used to help in smoking cessation. But it is essentially all the same thing. So all these artificial divisions are really just marketing divisions. All right, so that out of the way, let's look at the most common side effects. With the side effects, I basically took the studies done on this brand, the Bupropion SR. However, when I compared the results, it was very similar to the Wellbutrin XL, except that at the higher ends of the strength, obviously if you're comparing 150s here and 300s in this one, double as much, you're going to see that the side effect profile is pretty much the same, except that the percentage points increment slightly above what you would expect on the half-length strength. And that totally makes common sense. So what is it licensed for? It's licensed for treatment of depression. But as you just saw here, there's other uses as well. For example, in smoking. And that tells you right there that there's probably other indications that they're just not licensed for, because smokers often will take a cigarette to get a pick-me-up, which is basically combating depression. But you'll also find a lot of smokers, if they're under a lot of stress or anxiety or things just not going their way, the first thing they'll do is go and look for a cigarette to calm down. So I find it also works for anxiety too. So it works for mixed mood disorder, where there's combinations of depression and anxiety, but the official license is for treating depression, and under the Zyban flag for treating smoking. All the same thing, however. Don't be fooled by the marketing plan. So in terms of side effects, the study I was looking at, they had 873 people on the actual Bupropion versus 385 on a placebo. So basically taking a sugar pill or some other inert substance. So what did we find from that? We found that the most common side effect by far in almost 1 in every 3 people, so 27.5%, was headache. So headache was the main complaint by far and above any other side effect consideration. That being said, however, I have seen that starting people on Bupropion. However, very often, if the individual will persist with it for a few days, the headache will get less and less and then extinguish itself. And then for months or years later, you're still getting the benefit without the headaches. I can only think in the last year of one case where it simply was a deal breaker. I think they tried it for at least 2 or 3 weeks and found that they were getting a chronic daily headache. So that unfortunate individual had to stop that. But we were ultimately able to find something else that worked just as well. But for most people, this can be a deal breaker, but very often if they just persist a little longer, they adapt to it. All right, the next most common side effect in, what was it, 13% of people was dry mouth. And I've also seen this, but typically I've never seen it where it was severe enough that I had to discontinue somebody's therapy just on account of their dry mouth. It's usually more of a minor nuisance and not really a deal breaker, especially if it's working well for what we started it for, which is usually depression or anxiety treatment. So the depression or anxiety is usually far outweighs the balance of the nuisance of the dry mouth. All right, next up, in about 1 in every 10 people, so 10%, complained of nausea. That nausea tends to be a common thread across all drugs. Almost any medicine that you take can have a side effect of nausea. In some people, worse than others. Generally, a simple workaround for the nausea is just to take it with food, take it with mealtime. Think of it very simply. If you took a garlic clove and just plopped it in your mouth and started chewing it, that's a pretty intense and, especially if you're a vampire, very awful experience. However, if you take that same clove of garlic and you chop that up into little fine pieces and then put it in toast and then chew on the same thing, it's far less consequential. You hardly even notice it. So dilution of the drug by having food inside your stomach to buffer its presence makes a lot of sense in reducing nausea. All right, next up is, what was that one? That was nausea. So in about 8% of people, 7.9, complained of insomnia. So back to this schematic up here. Generally for depression, you're just taking these drugs once a day, usually in the morning. The only time that you're going to take it morning and night is when you're using it as Zyban for smoking cessation. So for the majority of people actually using it for depression or anxiety, I typically instruct them, don't take this thing at nighttime because it's stimulatory. So there's a good chance that it's going to affect your sleep. Oh, and I completely forgot to mention at the start there, the mechanism of action of this thing is quite different from most of the other antidepressants. So most of the other antidepressants are working on the SSRIs. They're like the dominant food group right now. So the SSRI stands for serotonin reuptake inhibitor. These fellas here, this other category, are SNRIs. SNRI. So the N there is standing for norepinephrine reuptake inhibitor. So what that's doing is when your circuitry releases some norepinephrine, instead of pulling it back out of the circuit immediately, these reuptake inhibitors force it to linger a little longer, increasing the rate of firing within those circuits that are affected. And what that translates to is feeling a little more energy and more drive and less depression. So this tends to be a more stimulatory type antidepressant than the SSRIs. That's going to be important in a sec when we come up to something else. So that's part of the reason for that insomnia side effect. The next most common, we're just doing the 5 most common. This is not an exhaustive list. There's probably half of 100 different side effects I could have listed. These are just the ones that were 5% or greater. The next one is 9.9% of people complained of like stuffy nose, rhinitis. This one is kind of hard for me to assess in my population because where I'm at, we've got lots of seasonal allergies. In the springtime, there's a whole bunch of pollens. And then in the fall, we get a bunch of other things like ragweed and stuff floating around. So the baseline population around me, including myself, tends to have seasonal allergies anyway. So it's kind of hard to distinguish whether somebody's coming in with a stuffy nose and sneezing because of some dandelions outside, or is it really because of the bupropion? And across my entire career, over the last 15 years, I don't remember ever having to discontinue someone's bupropion therapy because of rhinitis itself. All right, so those are the main 5 side effects that might be a barrier to you getting the excellent results you're looking for from Zyban. Like I said, most of them are pretty straightforward to deal with. The headache might be the only one that, if it won't subside on its own, could be a deal breaker. And then it's very simple. You just switch out of this class and maybe go back to the SSRIs. No, so who do I typically keep in mind to put on this stuff? Who's a good candidate? So the main people that I usually would consider putting on bupropion as first-line treatment is people who are not just depressed, but lethargically depressed. So these are the guys that they can't get out their own way, they can't get out of bed, they got no interest in anything, no drive, no motivation, no ambition. They're just tired and they feel low. So those would be guys who I would consider be a good candidate for something that's a little pick-me-upper. So these guys who are lethargically depressed. So who else? So that'd be 1. So who else do I keep in mind for bupropion? Well, smokers. So if somebody comes in and they tell me they're suffering with low mood and depression and they feel like life's against them, and they tell me that they're smoking and they would like to quit, well, why don't we just kill 2 birds with 1 pill? Start them on bupropion, aka Zyban, fix the depression, fix his smoking at the same time. Beautiful. Easy peasy. All right, third guy that I would consider this in is very often with the SSRIs. A lot of guys in particular complain of a lot of erectile dysfunction or sexual dysfunction in general, loss of libido, etc. I don't want to say a lot, but proportionately, it's a lot when it's happening to you, put it that way. So the bupropion family group tend not to cause any sexual dysfunction. So in somebody who needs something for depression, they start on an SSRI and then they notice again these taking the joy out of their life because they got no libido anymore, then I'll probably try switching them and try out the bupropion. Problem solved. And then a 4th group that I would tend to keep in mind for using bupropion is those in which they're on SSRI, is working pretty decent, but they've reached the maximum dose you can take. So say I have somebody on Paxil, they've reached up to 40 milligrams, I can't push the dose anymore. They're feeling a lot better than when they're on 0, but they're still not quite there. Well, in a case like that, then I'll do a combination. So I'll combine the SSRI and then add in a low dose of the SNRI. Magic. So that, ladies and gentlemen, concludes a quick overview of some of the side effects that you might experience when first starting out on bupropion, Wellbutrin, Zyban by another name, and some workarounds over it, and who in the population of those depressed or anxious most would benefit from being on this drug. Overall, I've had very good results with it over the years, as with many others. Obviously, it's never one size fits all. It's not going to help everyone, so some people need to keep searching. It's just like trying on shoes. So that's bupropion in a nutshell. Thanks so much for watching, and we'll talk again soon.
Thanks for watching. Get notified of new videos. Subscribe now.
If you found this video helpful, support us by sharing it with all of your friends. and throw us a like below. You're a star. Cheers and cheerio.